Okay, good morning. Welcome to the January 20th, 2022 meeting of the Needham Board of Health. I'm Rob Partridge, Chair. This open meeting of the Board of Health is being conducted per the Governor's Executive Order of March 12th, 2020, and as amended on June 15th, 2021, due to the COVID-19 pandemic. The materials for this meeting have been circulated previously and are available on the town website. This meeting is being recorded. Public comment is not anticipated. I'll introduce each board member and each participant on the meeting agenda. Please respond by saying yes when your name is called. Steve Epstein?
Yes.
Ed Cosgrove?
Yes.
Kathleen Brown?
Yes.
And actually, I can't see all the participants, but Christina is not currently here.
Yep,
okay.
I was going to try to promote them sort of as they came up on the monthly report section, just to try to keep the screen a little less cluttered if possible.
Okay, that's fine. Okay, so the first items on the agenda are the minutes from December 14th and January 5th.
I have some edits. From the 14th, page 2, it says that I gave the update on substance use prevention for Karen. I don't know who did, but it wasn't me.
Okay.
And then let's see, is that it? And then further down on page 5, where we talk about 1688 Central, it says the board agreed. I would like to say, it says every precaution. Can we just say precautions must be taken to mitigate? It's not every precaution. And then testing by an independent evaluator should be changed to review by an independent evaluator. We're not collecting samples. And
okay.
One more. So a little bit confused under other on page 6, where it talks about what the next steps would be, that Tiffany would make a recommendation to town management that masking indoors be required. I don't think that was the case. I think it was discussing the implications of requiring it in municipal buildings, but I don't know.
Okay.
It's a little vague.
So we can, if the board members vote in favor, we can certainly make those edits.
I also have one other edit. Page 4 says something here that I would contact Brookline for feedback. I thought that staff was going to be contacting Brookline. We were going to get somebody from Brookline to perhaps even come to a future board meeting to discuss kind of their tobacco-free generation proposal.
Okay, great.
But I didn't think I was going to be reaching out to do grassroots efforts.
Oh, that's fine. We can certainly reach out. They are between directors right now. I think they're going to have an announcement at the end of the week on a new director, or I know they're going to have an announcement at the end of the week on a new director. So I will get in touch with that person. I'll give them a day or two, but I'll get in touch with them next week.
And I have one edit on page 4 under the decriminalization of controlled substances. It's in the last sentence, second to last sentence in the first paragraph. It should be to decriminalize entheogenic controlled substances. This implies it's all controlled substances.
Okay, sorry, that's on page 4, this last paragraph. Yeah.
So it's actually second to last paragraph, second to last sentence.
Mm-hmm.
It says to decriminalize controlled substances.
Okay.
And it's entheogenic
Okay.
controlled substances.
Okay. Great.
Okay. So a motion to any other edits or comments from board members?
I do have one. Oh, I'm not a board member, so I should wait till the other board members have a say. I did get a suggested edit from Karen Shannon. I think it's similar to what Kathleen had said. And specifically the sort of the paragraph under the one that Kathleen had highlighted.
Can you give us
Karen,
a page where we are?
Sure, let's see, that is page 2 under substance use prevention. We'll change the Dr. Brown for Karen Shannon. The second paragraph in that section that begins Miss Shannon. So it shouldn't be 11 compliance checks. It should be the Needham Police Department, in coordination with Needham Public Health, conducted alcohol compliance checks on December 1st, 2021. Of 31 alcohol licensed establishments, 25 of those businesses were checked. There were 11 sales to minor violations. 6 of those sales did not even ask for identification.
Okay. I wish I had those stats in my head on the percent of alcohol, but that I think would also be her as well. Dr. Brown noted.
Yep.
30%. So just, wherever it says me, make it her.
Yes.
I'd love to claim to have had that in my head for that meeting, but I didn't.
Okay.
Okay. Anything else, Tim or other board members? Okay, a motion to accept the edits as described.
So move.
Second.
Okay, all in favor, say aye. Aye.
Aye.
Aye.
Hi, Kathleen.
Okay, great, thank you. Moving on, staff reports. I think first up is emergency management. Michael.
Great. Let me promote folks to panelists. Oh, I do have one question in the chat from Lynn, who does editing on the minutes. She was saying, is it possible to use psychoactive rather than entheogenic, or is entheogenic the preferred phrasing?
I mean, entheogenic is the, I guess, the standard medical phrasing. The other word you could use is psychedelic, but I think it's entheogenic is a better choice of words, considering, what is being considered.
Okay.
Psychedelic just has negative connotations.
Okay.
I have a question about the agenda. Were we supposed to be reviewing the January 5th minutes also?
I was just going to say that. Yeah, we had 2 sets of minutes in here.
Yes, I'm sorry. I thought we were kind of doing them all in bulk, but yes, we do have 2 sets of minutes. So before we move on to staff reports, yeah, let's go over the January 5th minutes.
Okay.
I just have one minor on page 7, kind of middle of the page, where it says Dr. Brown asked Ms. Acosta. She stated that the training is available online for a minimal cost. I think we could just make that the food allergy training, just because it seemed a little vague. We hadn't been talking about food allergy training prior to that. That's all that pertained to. So that's it. That's my only comment.
Okay, other comments? I didn't have anything on the January 5th minutes.
So
I'll
I can
move
make
it.
a motion to accept the minutes.
All right,
From
I'll
January.
second that.
Okay.
I'll second.
Okay.
Okay, all in favor, say aye.
Aye.
Aye,
Aye.
Kathleen.
Steve,
Yeah, aye. Sorry,
it's okay. You got,
I'm freezing intermittently.
Okay.
and Rob is aye. Okay. All right, so moving on. So starting with emergency management, is Michael here? Would you like to present?
Yes, good morning, everyone.
Hi.
So for emergency management, the big item that we began tackling over the last month has been continuity of operations planning for the town. The last time the town engaged in continuity of operations planning was in 2019, where we got about 6 or 7 town departments to draft COOP plans. But with COVID, that fell off. But now I think, you know, every department had to COOP as a result of COVID. So now is a good time to sort of capture those lessons while they're still fresh in people's minds. So we did an overview of the COOP process at the last local emergency planning committee meeting. And then instructions were sent out to all department heads. This go around, we're using a much more simplified worksheet that was provided to us by MEMA. And so the first step of this planning process is going to be to have town department managers simply identify their essential functions and the essential tasks and resources and people required to accomplish those functions, as well as any vital records they may have, and the location of those records, as well as any backups. And so that's due back to me from the department managers on March 1st. And that's really going to serve as the bulk of the town's COOP plan once all those department worksheets get folded in together. We're continuing to support town departments with resource requests from MEMA. Both the police and fire departments had a substantial resource request into MEMA a few weeks ago for both PPE and cleaning supplies. Yes, and I would just reiterate that MEMA does continue to have a large stockpile. So if any town department or qualifying nonprofit needs PPE or cleaning supplies, MEMA is available for those. The one thing they do not have in their stockpile are any tests. And then we reached out to MEMA a while ago about potentially using the new public safety building when it's completed as a training location for MEMA's free trainings. And MEMA is really excited about that, and they've reached out and they're going to do a walkthrough once the building opens because of Needham's location. It's really convenient for people in the area for MEMA to host regional trainings, but it is also an advantage to the town because we would obviously get preferential seats in any incident command system class or any other class like that MEMA would put on. Are there any questions for me?
No.
You said MEMA has PPE. Does that include masks, Michael?
It does. It includes both N95s and surgical masks.
Okay, so Tim, that sounds like maybe a resource we could tap into for making masks available in places like the library and senior center and so on if we need it.
Sure. Michael may have to correct me. I know earlier in the pandemic, the masks were restricted to public safety agencies. Michael, is that still the restriction in place or no?
I don't believe so, no.
Okay, great. Well, that's a good option. We did place an order yesterday for 1,000 KN95s. We did go through the stockpiles in the basement, and we have quite a lot of surgical masks. We have quite a lot of counterfeit KN95s as well. So we won't be distributing those. We got a lot of them.
They're probably as good as the surgical masks.
I know. I think I just worry about people making assumptions.
Right.
So we have plenty of surgical masks to give away. We ordered 1,000 KN95s that are verified. We would have ordered them sooner. It's just we had picked the same supplier that the Needham Public Schools picked, and they ordered quite a lot and cleaned out the vendor. So we had to find a new vendor or a new type rather. But I think that's a good option. I didn't realize MEMA had lifted the restriction from public safety. So.
Yeah, I know because they said, nonprofits are available as well. So I can reach out to Christian Cooney and double check and make sure that is the case, that we could use them for like at the library or something.
That'd be great. Thank you.
Thank you, Michael. That's great. And yeah, we look forward to hearing more about the trainings in the new public safety building.
Thank you.
Okay, moving on to environmental health.
Okay, I'll start off by giving a couple updates. So I know Diana will get in more in depth than Hungry Coyote later on in the report on the agenda item, but we did confirm yesterday that Burger Food Safety was out there training starting yesterday. Pedro is out there with the staff and Eileen
Hungry Coyote.
in next week. So that's good to know that they've acted on that as far as the condition on their food permit. Couple housing highlights I'd like to just to give the board an update on. So Enslin Road, as you can see, I was contacted by the owner's representative to do a follow-up inspection. That's that house that was hoarded, that had the dog, that's been going on for a while. So she did have a professional cleaning company come in and I was out there to re-inspect. So it's definitely cleaned out. You know, most of the furniture was removed. The house was pretty much empty. However, there were, you know, holes in the wall, gaps as far as because they had to cut out some mold out of a closet. And there was also no heat. There was no plumbing. The toilet, the plumber was there working on the plumbing when I got there. So I just issued another letter stating, you know, what I observed and that it was still not inhabitable, but that's what she needed for court. So we'll just have to see how that plays out. But we made it very clear to them that they'll have to, again, if they're looking to re-rent it, I don't know what the long-term plan is going to be for that house, but they would have to get a sign off from Public Health Division before they did anything with re-renting. I think it's just going to get torn down myself, but we'll have to see how it all plays out in court. We did get a call from fire this past weekend about 55 Linden Street. That's that vacant house that, again, we've been working with an owner on. It's not inhabited at the moment. The owner was living with her son in Boston with the kids. I don't know if you remember this one. Basically, we got a water pipe burst in that house, and that's where fire had responded. They had called public health saying that we didn't need to head down there, but that we need to look into this because it definitely was in disrepair. They had to shut the electrical, the gas, the water. So we've actually been working with the Attorney General, Dave Roach, Building Commissioner, and Public Health on that, been on their list. They actually sent the owner a couple letters last month. Still waiting to hear back from them. It sounds like as of today, we got guidance from Chris Heap, Town Council, and Kate Fitzpatrick last night answered that we're going to go ahead and have Attorney General appoint a receiver for this property because the owner is not, corresponding back and forth with us. We haven't heard from her. So that's going to be the next step for that property. So we'll see how that goes going forward. So those are the two highlights on my end. Diana wants to go.
I was going to ask the board if there's anything you wanted me to highlight, because as you know, Hungry Coyote took a lot of time and I'm already going to be talking about that later. Otherwise, December, majority, feel like it was at least, not an exact number, but at least 90% of the permits were out. Next month for January, you'll probably see a little bit more of the stragglers that had the last final minute permits come in, like right at the first week of January. Because some of them, it's just payments getting processed a little late, reminding them to get that. But majority of the permits have been issued already, and that's all set. So if you guys have any questions about anything else more specifically, I'll just hold off on my discussion of Hungry Coyote until that comes up on the agenda.
Actually, can I ask about the bed bugs?
Yes.
So how does it, do we think they were really there or not?
So I got the report from PestX and they said they only found 2 dead bugs and they didn't find an active infestation. I had called them and made sure that they checked all the rooms because when I initially spoke with North Hill, it kind of sounded like they were only concentrating in that one room. And I just wanted to make sure that the company was doing the typical procedure of checking the room to the left, to the right, up and down. And they did. And in that specific home, they didn't find an active infestation. That's what was reported.
Okay.
I'll follow up with them again because they were supposed to put some sort of basic treatment and come back 2 weeks later to see if there was any activity. But in his inspection, he didn't see anything actively happening. It was just 2 bugs.
Okay. Thanks.
Diana, if I may, I know we only got notified of it last night, but maybe you could mention the grants that you had written.
Yes. So I had worked on a grant. I'm actually shocked that I got it, but I worked on a grant from the state. The state is giving out purple air sensors. So I still have to get the final number of how many we're getting, because Kate Fitzpatrick actually got the email that notified us of getting it, because she was the main contact that I had to put on the application. But we're getting some purple air sensors that we're going to come up with a plan to deploy them around town. I'm thinking it'd be a great idea to collaborate with the schools, either a high school or one of the elementary schools, so it could be a fun project for the kids. But it's exciting. We found out last night. I was very shocked, but happy.
How many
Great.
sensors does this grant award?
So I applied for up to 10. The email that we got yesterday didn't specify. I think it just alerted us that we were awarded sensors, and we're going to have to do the paperwork to finalize it. So I'll find out how many we have.
Okay, congratulations anyway.
Thank you.
Yeah, congrats. Great idea for the schools.
I think it's a great idea. It's great that we got it. I think Diana, I'm surprised because it was so long ago.
I know.
Yeah.
Normally,
And they
Emailed
were-
like 6 months ago about it or something,
Yeah.
right? Like,
Yeah, because I remember I was at a conference and everything. Like, it was warm outside.
yeah.
But it's a
it
good
was-
project for the kids too.
Yeah.
I was
I'd
more
like-
surprised because it was for environmental justice communities, but we still got it, so that's great.
I think we can think about deploying in those locations. Yeah, that'd be great. I think it's interesting. 10's a lot for Needham. That would be a lot. Be interesting. So,
I just applied for the max, so we'll see what we actually got.
yeah, fun.
Always ask for more.
Any other questions for environmental health? No? Okay.
All right. Next item is traveling meals. Is Marianne here for what I believe maybe her last report as the program coordinator?
hopefully not her last one, because Marianne, I think will be here for the February meeting. But Marianne, do you mind giving a brief update on the traveling meals program?
You hear me?
Yep.
Can you hear me?
Yes.
Okay, thank you, thank you. I think I might be here for February, but we'll see. So any questions from the existing report? So you're not going to ask me how come the numbers are up, but anyway, the answer for the numbers being up is because we delivered the 24th, that Christmas Eve, and the 31st, New Year's Eve, because volunteers were available. So that having holidays changes things. So that's that. And this Tuesday, day after Martin Luther King holiday, 3 consumers were not home, which is always a point of anxiety. Was able to locate one person around 2 o'clock. He had gone out and left his phone behind. The other person I couldn't locate till 5 o'clock, was out of Needham in Framingham, visiting with someone for the long weekend and didn't notify us. And then the third person was a 911, and she's at Beth Israel here in Needham in intensive care and is on the mend, is what I've been told. So here it is. The program works. That's all. Okay. Done.
It certainly does work.
Okay.
Thank you. So it sounds like you're not sure if you're going to be with us on the meeting on February.
Oh, no. Let's see how the new person feels about the transition. I will work with that person the best I can to pass on the responsibilities. But, you know, sometimes it's just good to just get in the fire. I don't know what to say. There's a lot to this job, folks. That's all I can say. So
I think
Oh,
we,
well-
we I think we hope to have Marianne come to the meeting briefly. Marianne is incredibly hardworking, as I think the board and the staff and certainly all the recipients of the Traveling Meals Program know. She doesn't like the limelight. She's a little shy in that regard. But we do want to recognize the hard work that she's put in over the years to help make the Traveling Meals Program a success. To say she's a force of nature and to say she's dedicated to the recipients is to greatly understate things.
I
Exactly.
appreciate that. It's really not necessary, and it's so out of my comfort zone, folks. If you could not do that, that would make me one happy person.
We don't need to
It is.
dwell on it, but we are very grateful for you and your hard work.
I think we do need to recognize your contributions.
Yeah, it's my job. That's what it is.
Your job, but you did it. And you
It's a
did,
job.
did a great job. So
Thank you.
actually
Thank you.
I did a quick calculation and I multiplied 825 meals by 12 by 28 years. And that came out to 250,000 meals.
That is scary.
Oh.
What the volunteers
Wow.
do.
And that-
They
that
do
is
that.
really-
That's
It's a
unbelievable.
tremendous service to the citizens of Needham and to the health department and the Board of Health. And I can't tell you how much we appreciate it. And
Thank
I'm
you.
honored to be the chair to be able to say that, because I'm sure you've
Thank
gone
you.
through, I don't know how many chairs in 28 years, 28 probably.
I used to say to myself, I'll be here long after they're gone, but now I'm going. Okay,
But
thank
the,
you.
We hope the transition goes well, and we do hope to see you next month. if
I
possible.
hope it goes well as well, and I hope you get 100 applicants. So we can find someone. Thank you.
Thank you.
You're welcome. Thank you.
Okay. Let's see, next up, we have an update on the accreditation report from Lynn Sheff.
Yeah, so,
Morning.
hi, everybody, good morning. I'm going to start just talking about the Pathways Program, the Public Health Accreditation Board Pathways Program for smaller departments. I submitted, I think it's in your packet, a summary of what that program is. So what we had to do initially is to fill out a readiness assessment. And I'm really looking forward to getting feedback from the Public Health Accreditation staff members, because they're going to look over this assessment and let us know how ready we are to move forward, either in the Pathways program or for full accreditation. Next is the Public Health Workforce Survey. 100% of our staff completed that survey, which is pretty remarkable. None of the other departments that participated in this project came even close to 100%. So I'm really pleased about that. And I'm looking forward to that report as well. Also, your packet, I believe, is a summary of the proposed public health accreditation standards and measures. And those are the measures that we are testing against in the Pathways Accreditation Board, the Pathways. And finally, I am very pleased to say that we received, after 3 years of trying, a grant from the Massachusetts Office on Disabilities. What this will fund is a self-assessment and transition plan. That's what it's called. And it's actually all the towns in all the municipalities are actually required to do this. We don't have one in Needham. We're hiring a consultant to assess all the municipal buildings except schools and recreation facilities as well, fields and playgrounds, to determine whether or not we're compliant with ADA. Once we accomplish that, we then become eligible for funds to make capital improvements. And that's really our ultimate goal. Any questions?
I have a question. We didn't see in our packet the Pathways program. We just got the Accreditation Board Standards and Measures, the new version of that, or at least a précis of that. So I'm wondering, is the Pathways program a pathway to full accreditation, or is this a different standard?
It is, it can be a pathway towards full accreditation, or some health departments may choose to just go through this initial program, which measures are, the measures are against some of the accreditation standards. And that will provide smaller health departments with an acknowledgement of having achieved some professional standards. So I'm sorry that it wasn't in the packet, it should have been. It is a way to recognize smaller health departments that are not able to apply for full accreditation. And it can also be smaller steps towards full accreditation.
Okay, so I mean, I guess the other question is, you know, in the new rubric, are we actually able to apply for full accreditation, or is that not possible?
We are able, anybody is able to apply for accreditation. Having submitted the readiness assessment, we will get feedback from the Public Health Accreditation Board as to whether or not it makes sense for us to pursue full accreditation now or maybe in the future.
Okay, thank you.
I think we're too small for full accreditation.
Other questions for Lynn? All right, great. That's great news about the self-assessment grant as well. So great to hear that.
Excellent.
Thank you. Okay, so moving on, public health nursing. Is Mary here?
Mary is not here. She's commuting right now, so I will be just
Hello,
going
dear.
over the report real quick. Hi, everybody.
Morning.
So we spent the month of December really just doing vaccine clinics and the case investigations, and then a little bit of anything else. Mary had her first class of the take-home naloxone program, and she had 6 participants in that. It went well. I have continued to give support to the youth sports organizations as they are trying to meet the requirements of the Article 24. And most everybody who's currently has a building permit has gotten all their paperwork in, but there are some, there's actually just one more that they have some follow-up to do. In total, we gave about 1,905 first, second, or booster doses, and about 400 of those were for the children. So I would say that we had a pretty good attendance to the clinics. We had a lot of per diem nurses and volunteer MRC members who helped with the clinics, and we held all of them almost at the CAF, which has turned out to be a fantastic place for that purpose.
And Hannah, we've seen some sort of ebb and flow in the interest in booster shots, right?
Definitely. Like December was, I felt like it was really good month. We averaged about 400 per week. And now in the last 2 weeks, I think I've done maybe 80 in 4 clinics. Like on Friday, today's what? Oh, so on Tuesday, I had 11 people. Mm-hmm. And the Friday before that, I had 20.
Yeah.
We are doing a clinic this Friday that I have 14 people signed up. And then we're doing one at Olin College, which is the second time we're going there because they made it a mandate that or requirement that they have the booster dose. So there's 25 signed up for that. So it's very small numbers to what we could do.
Yeah.
And then I reached out to the housing authority, and they're gauging interest there if the residents would want us to go and do a booster clinic there, if that would make it easier for them. And then I also reached out to the health director at the public schools, and they said they might be willing to have us come either to the middle school or high school and just do a couple more clinics there. We do have a 5 to 11-year-old second clinic coming up on the 29th.
Great.
So hoping to make it available for everybody and easy access, but it's.
Yeah, it is hard to anticipate demand, and we got to always keep sort of reaching out. I do know that the Executive Office of Elder Affairs put out, I think it was over their social media, a stat that basically there were 400,000 seniors across the Commonwealth who had gotten 2 vaccines but had not gotten their booster shot yet. So there still is a portion of, well, we know there's younger portions that haven't gotten boosters, but there's still a portion of the sort of higher risk seniors that have not gotten booster shots.
Mm-hmm.
So there are people out there who still need it. Hopefully we can reach them and convince them to come in.
Yeah, that would be great.
Are you hearing any reasons why people are reluctant to get the booster shot? They think they don't need it, because it's obvious when you read the statistics in the paper.
Great. I honestly haven't, because the people who come, they want it.
Yeah.
And yeah, but I am wondering, just for our clinics, I do wonder if it's the time of the clinic, because, we do them during the daytime, or, we have clinics from 9 to 11 or 9 to 12. And then sometimes Saturdays, that it could be that it's inconvenient for people. I also wonder, because we do require registration prior to, even though it's super easy, that if maybe that is a turnoff for somebody who would just like to just walk up. So we're talking about maybe offering one more evening clinic and see if there is demand for that, or early morning. The Saturday clinic on the 29th, it's for 5 to 11, but I did tag on there an adult clinic, or like 12 and up clinic after that. And there's maybe 20 people signed up right now. So.
Can people sign?
Yeah,
I'm sorry, I didn't mean to cut you off. I was wondering, can people sign up over the phone? Because some people may not have computer access or may not be computer savvy.
Right. So they can sign up. They can actually call 211, which is a state line, and they will register them to the Needham Clinic if they so ask, because that can be found in the Vax Finder. They can also, some people do call us in the office, and sometimes we definitely sign them up if it sounds that they can't sign up otherwise. We also do sign people up on the spot if they come and they say that, I was trying to make an appointment, and usually we always have more vaccine than, I just bring extra so that then we can facilitate those.
The Aging Services Division will also have their staff and volunteers enroll people. If they call the senior center, they can sign them up. If they're not comfortable using the computer, they will enroll them.
Okay. Any other questions for Hannah? All right. Thank you.
Thank you.
Keep on vaccinating.
I will. Thank you.
Yeah, go ahead, Tim.
Talib is not going to be with us this morning. He did include a brief update, which is assisting with, the booster clinics and working on, he was the primary author. Tiffany also did a lot of work on it, an application for a grant to the Metro West Health Foundation. We applied for funding essentially for, I'll double check myself since I wasn't that involved, an Abbott Binax Now testing machine, a couple hundred test kits, and a clinical staff person to run it part-time for a year. Metro West Health Foundation, because of the Omicron surge, made up to $50,000 available to any health department that put together sort of a plan for COVID testing, PPE, etc. So that was the plan that we submitted. We're hoping to hear by the first or second week of February whether we receive that. If we don't get the Metro West grant, I think we will try to still move forward either with operating budget or ARPA money to purchase that. It would allow us to test not just for COVID, but for flu and other respiratory system viruses. So we think it has utility beyond immediate pandemic needs as well.
I don't think it's a Binax. I think it's the Abbott, like the machine.
Yes,
right?
sorry.
That was used at the White House Rose Garden. But it's fine.
Yes,
It's,
that's what I
you
meant.
know,
Right.
sensitive enough. Who's being tested? Do we know?
So I think it will depend sort of if we get it. I think we would try to prioritize those persons with more limited means. So maybe high-risk seniors, homebound residents who don't usually get out, housing authority residents. We certainly could make it available more broadly. It's not going to solve the need for testing, but it could help make a dent, especially for people who have less means to access.
Thanks.
All right. Thanks, Tim. Is Karen here for substance use prevention?
She's not, but we do have both Monica DeWinter and Jasmine Hurley.
Okay, great.
Hello, this is Monica DeWinter. How are you?
Good, welcome.
Good. I'm just going to give a brief update for the prevention team. We had our SPAN quarterly meeting December 14th, where we had 29 Needham stakeholders in attendance. The focus was on creating strategies for the coming year with action team breakout discussions for identifying prevention priorities. On December 15th, Karen Shannon and Sarah Shine of Youth and Family Services conducted a virtual mental health first aid training with 12 participants in attendance. And also this month, well, in December, the community action team completed two holiday themed PSAs around the dangers of impaired driving that were posted on SPAN's social media pages during the holiday week. Key to that project was Angie McDonald of the prevention team and school resource officer RJ Poirier, and it featured our community resource dog Rocket. That's really all I have.
And we'll be talking a little bit more with alcohol compliance as a separate agenda item later in the meeting.
Yeah.
Okay. Any questions for Monica? All right, great. Thank you very much for the update. Moving forward to COVID-19 update. Is Julie able to give us an update, or will it be you?
Yes, I'm here.
Julie is here. Yes, she's great.
Great. Hi.
All right. Let me share my screen. Okay. I know we have a lot on the agenda, so I'll keep this sort of general, and we've seen this data recently. So, you know, as with the sort of early January meeting, the daily incidence rates and the 14-day and the 14-day percent positivities are remaining pretty high throughout the state. I actually believe since I made this, Framingham has enacted an indoor mask mandate. I do want to note, obviously, we have a lot of work to do, but I'm proud of Needham for being the highest percent boosted on this table. Yeah, as I said, the 14-day percent positivities are still pretty high, but I did just calculate Needham's for this week. And it looks like it's 14.9%. So this sort of sharp slope that we've got going on here should start to ease a little bit. We could hope. When we look at the daily cases, I went back to November just because that was sort of our norm trend before Omicron. It's kind of hard to see in the graph, but when you look at the 7-day average, you can see that it's starting to slope downward, which is fantastic. Obviously, this does not include at-home tests, so this number is not going to be accurate. And I think that's just a trend that we're going to start to see. These metrics for official tests are going to become sort of inaccurate and maybe difficult to interpret as at-home testing becomes really popular. Just looking at cases from December 15th until recently and breaking them down by age, a lot of the largest proportion of cases kind of in this 19 to 59 group. When we look by vaccination status, I think this is another one that's starting to get tricky for us to track because there were so many cases coming in that it was hard for me to go in and review in MIAS whether the vaccination information I pulled from Maven is correct. So sort of take this with a grain of salt. But if this information is accurate, it would mean that 7% of our population, because remember 93% are fully vaccinated, would make up about half of the cases that we have. Again, I don't know that that's quite accurate because I know quite a few of the 5 to 11-year-olds are fully vaccinated. And it would mean about 2.4% of our vaccinated residents tested positive in this time period. Again, this data is pretty similar to the last time that I showed it. Our vaccination rate and our booster rate has gone up a little bit, but 93% are fully vaccinated, 57% have received booster doses. Obviously, the lowest category being the kids who may have just become eligible or not quite eligible for a booster. And to sort of speak on what we were discussing with Hannah, we do have some of these older populations that could definitely, there could be some improvements at about 75 or 76% boosted.
Julie, we don't have numbers for who's eligible for a booster, do we? I mean,
No.
again, you're kind of looking at those kids. A lot of them won't even be eligible, so that makes it look like we don't really have a goodly boosted vaccination. But it might be a lot better than 57%, depending.
Correct. Yes, I could definitely. I mean, I could break it down by the population estimates and find that number of who's actually eligible for the booster. I guess it would be tricky to find out when those age groups, like it would be a rough estimate because some of those age groups got the vaccine series at different times and it depends on which manufacturer you got.
Sure. But so I mean, my guess is that the older populations are, that's pretty clear. They've been eligible to be fully vaccinated and, and updated for quite a while now.
Yes, absolutely. Yeah, so that I think we've been kind of stuck around that 75, 76%. So yeah, it would definitely be great if we could encourage them and make it as easy as possible for them to get it. Okay, so I included this slide in the packet just to give a sort of boost to the public health nursing staff. But I actually went through and looked at the numbers from the beginning of vaccination, and 11,243 vaccines have been administered since then. 10,400 of them were COVID vaccines. It's very impressive. And going back to sort of this slide, if you take into account the information from the beginning of vaccinations, it's about 25 states and I think 300 cities or towns, which is really impressive. Looking at the state trends, obviously we've all heard that, with Omicron, a higher percentage of vaccinated individuals are becoming infected. So we're at about 5.1% of vaccinated individuals have become infected with COVID. 0.09% of those end up in hospitalization and 0.02% of those result in deaths. But when we look at the cases for the state, it appears that fingers crossed, we have hit the peak and we have surpassed the peak, and we're starting to sort of slowly follow a downward trend. Obviously, the concern here is that the downward trend may be very slow, and the downward trend from this very sharp peak still means that we're going to have many cases per day. But it's good news, and the daily percent positivity for Massachusetts has also been slowly decreasing. We all saw in the news that the wastewater monitoring has been a good indicator of sort of where we stand with a peak. And I think we probably all seen these graphs, but it seems to be sort of good backup news for our daily case rate dropping, is that the viral RNA signal is also dropping. The south system is where Needham is. So obviously, even though the cases are falling, sometimes hospitalizations and deaths can lag behind that. So we still want to keep an eye on that and remain diligent. The hospitalization rates are all, for the most part, all much higher than they were a year ago, except maybe this 70+ categories. And we still caught up to the astronomically high rates that they were at a year ago. If we look just at the children under the age of 19, we can see like the 0 to 11-year-olds and the 18 to 19-year-olds, these rates are about 7 times higher than they were a year ago, which is incredible. A caveat to this data, and my last slide being that the state has started to have hospitals break down the data. I believe this came up in our last meeting, between who is admitted primarily due to COVID and who is admitted for something else and then test positive for COVID, because all people who are admitted are tested. And they started breaking that data down last week, but it hasn't been included in the reporting yet. I believe that should be reported in this week's data. So I think that these numbers could change very dramatically. And just doing some research, anecdotally, I have seen interviews from epidemiologists at local hospitals that say that the number of patients being treated for severe COVID-19 are considerably below 50% of all COVID hospitalizations. So the hope is that the next time I'm showing you these graphs, they will be much cheerier, less sad. So I'll be interested to keep an eye on that in the future. And that's all I've got.
Thank you, Julie. Yeah, that's certainly what you mentioned at the end is what I'm definitely seeing in the hospitals. You know, we have people that come in for the usual emergency department conditions, and they get admitted for that, and they also happen to have COVID. So it'll be good to see what the data looks like when it's separated out. I'm sure Steve has had the same experience.
Yeah, I think the state, they're looking to report steroid use and like nasal cannula, oxygen, supplemental oxygen as indicators of for COVID versus when, yeah, there's just a huge number of cases. It's also pretty clear as a paper this week from Denmark that it's waning immunity is the main, that's why you see it in the groups that are further away from boosters. I think, you know, encouraging boosters is really key right now, I think, for our population.
Yeah, although I'm certainly, so the sickest people I'm seeing are the ones that receive no vaccine at all.
Yeah, right.
It's amazing to witness it after all we've been through, but there's still many unvaccinated.
Mr. Chair, the next topic on the agenda is the Center for COVID Control. And I know that Ms. Matthews and a couple of the other board members had asked questions about that topic. I had included in your packet some of the correspondence that the town had sent to the Attorney General's office, as well as a similar letter that had gone to the, exactly the same letter, I think went to the Department of Public Health. The copy of the letter that the Department of Public Health asked me to deliver a cease and desist letter to the organization. I did include the press release from the company sort of saying we will return.
I won't.
The site on right across from Town Hall is very empty, so it does not look like they're imminently planning to return. It's the state's position that they are operating as an unlicensed clinical location in defiance of state law. Ms. Matthews asked sort of how this sort of happens, how a business like that is allowed to open. I think from the town's perspective, we can only enforce zoning bylaws, town bylaws, general bylaws, things that the town has direct control over.
Right.
So when you're thinking about like zoning bylaws and land use, it's which type of businesses are allowed to operate in which zoning area. So, you know, you can't operate an oil refinery in the downtown, but you can operate sort of a general storefront. When you think of like a law office moving in or an accounting firm, the town confirms what type of activity you're doing and make sure it aligns with the zoning. But we do not have any role, and historically we have never had any role, for example, checking with the bar association to make sure that you are a lawyer who is in good standing with the bar, or making sure you're a actual licensed and certified public accountant. So I think that those usually fall to state licensing boards or professional association crediting, like accrediting agencies. So I think the challenge here was there was a period of time where we were getting some reports, and it took a while till they reached critical mass, you know, complaining about the service, complaining about not receiving test results. We did research and became aware of investigations in other states into the company. And that's when we started to push. We did some pushing that, you know, wasn't captured in formal letters, but was done informally. And then we formally pushed the Attorney General's office on a Friday. I got called at home at 9 p.m. on my personal cell phone, because people at DPH still have that, saying they were going to issue a cease and desist letter and they would like me to deliver it in the morning, which for state agencies is pretty record time to respond to something. I think it's still frustrating that there's an organization that took advantage of the concern that people have for their own health and the health of their, you know, friends and family, and appears to have been exploiting that by either not running tests or taking a volume of tests that they knew they could not provide results in anywhere close to remotely the time needed to get back to people. So the preliminary investigation seems to indicate that all of their facilities across the country, there was one lab total in Illinois with which they were affiliated, which couldn't process. I don't know if it could process the volume of 2 states, let alone, you know, the dozens of states they were operating in, and you know, how they're flying tests back and forth and whatnot. It certainly is frustrating. I don't know if that answers some of your questions, Christina.
Yeah, Tim, I just wondered, is there any kind of local permitting process for an organization like this coming to town?
We have no licensing over a clinical facility. There is zoning to say what type of, you know, business you are. Are you a dentist's office? Are you a whatnot? But we match that, and by we I mean the town, and specifically the building commissioner matches to make sure that, like I said, you're not running an oil refinery in a, you know, residential district, or a, you know, manufacturing in a commercial district. But if it's in one of the approved classes of use, which this was sort of essentially general office, then we don't have any sort of legal standing with which to challenge anything. I think that's why we had to involve state agencies.
Yeah.
I think it's frustrating, right? If you think someone's doing something wrong, you'd want to think that there's something that gives you the authority to stop them without having to ask other people for permission to do that.
Do we know when they opened? How long they were there?
They opened in late October.
Oh, okay.
For them to get up to actually serving a lot of people.
Okay. Mhm. Yeah, there's always a line up front.
Yeah, I don't think it became obvious to people until that line developed out front in the last month or so.
Mhm.
Otherwise, there really didn't look like there was any activity there for a long time. It seems to me that we did the job we're supposed to do in a sense, in that we contacted the state agency and said, hey, wait a minute, do you know these people are out here doing this? And what is it? Healthcare quality at DPH, isn't it, Tim?
Yes.
And they inspect labs, and so they would be the ones who would have the responsibility for certifying and approving these people.
I think it's still frustrating. I think
it is frustrating.
We did get some complaints. A lot of them were sort of, I'm annoyed with this person, not I think I've been defrauded, which I think, if it maybe it wasn't until we started getting a critical mass of people saying, I'm confused, I'm annoyed, I still haven't got my test results, and it's been 2 weeks, it's been 3 weeks. I think there was a time where we thought they were just an inept testing operation, not they appeared to be running potentially illegal activities or not sort of on the up and up.
I think what will happen is that if they were charging the Medicare, I know Medicare, and then private insurers for PCR tests, and then weren't doing them, there's clearly fraud there. So we're going to see fallout from this.
Yeah, I think it is frustrating. I wish there was something in place, and but I think it's a question of can we figure out maybe a better way to track complaints sooner so that we see patterns earlier. I don't know that realistically the town has the bandwidth to perform sort of a duplicative like licensing function, like checking their bar credentials. We do it certainly for things we and we'll talk about it a little bit later in the packet, I guess, for organizations we license. So like the Cannabis Control Commission asks for CORI information, and historically we have asked for copies of that information to verify. There's a memo in your packet suggesting that maybe that's not necessary anymore. But if we've never actually licensed them, we never have sort of been involved in the verifying their credentials. The next, if there's no further questions on that, Mr. Chair, the next topic on your agenda is seeing whether the board wishes to further discuss the the emergency order mandating mask use in select municipal locations. The board did receive, and I had forwarded it along to it, an email letter from Greg Reedman, who's the president of the Charles River Chamber of Commerce, on behalf of his board, asking the boards of health in both Needham and in Wellesley to consider putting in a across the board mask requirement in Needham and in Wellesley, which would be similar to the ones in place in Newton and in Watertown, which would be other communities that are in the Charles River Chamber.
Yeah, I know. I'm sure everybody's had a chance to read that, and I received that even before you sent it to me, Tim. It's a difficult decision. The data he has. He sent out a survey, and it sounds like there was a significantly positive response from businesses to have a temporary mask mandate. However, it sounded like there were also a large number of businesses that were still concerned that would negatively affect their business. And now it's just a difficult decision about how to proceed when we may be hopefully on the downslope of this current outbreak of Omicron, and whether a mask mandate for all businesses in Needham would be effective.
I was a little bit confused by point 1 in his note, where it seems that he's more concerned about employees who are unvaccinated, to which I think my response would be, let's get them vaccinated, as opposed to putting in a mask mandate first and foremost. But I don't know if anybody has additional information regarding that.
I agree, or provide KN95s. If you're worried about your workforce, and many places are doing this, including the schools, those workers can choose to wear a high-performing mask. Getting everyone to wear a cloth mask that's doing nothing will do nothing. And I'll reiterate that mask mandates across the country have done very little, right? I mean, the case rates in communities with and without track exactly. People don't wear them. So if you're worried about your workers, protect your workers. But I don't see the benefits of a mask mandate that then, going back through actually the Hungry Coyote stuff, some of that's, the tables weren't far enough apart. Some of this is going to look odd when we look back at it, mandating masks that don't do anything for 2 years. So yeah, I think if companies want to protect their workers, they can choose to, provide masks are widely available and inexpensive.
The way I interpreted that first point too was that, there are establishments, some of which I've been in recently where like a hair salon I was in recently where a lot of the staff were not wearing masks, but then there are a couple who are. And so if it is required, then it does kind of provide some overall protection for those that, might have underlying illnesses, those who do want to protect themselves and the patrons that are in there. So I think it's, I don't know, I saw it as kind of an employee health issue too, that, if you are someone who is vaccinated and is masking, but then you're surrounded for 8, 10, 12 hours by folks who might not be vaccinated and aren't masking, then that is a tricky situation. And it is tough because then the next day he sent out that other email that said, he got messages from businesses that don't want this and say, well, it might impact their business. I felt like if it is temporary, if we said for the next 1 month, well, case rates are still high, and and transmission is so high, I think that to me could make sense for the next month or so. What are you thinking, Carl and Kathleen?
No, I don't see introducing it now that we're on the downswing of case rates. Wellesley upheld their plan as well last week. Their board met, I watched their meeting. They decided the same, and we are at this point where people have to, choose their risk profile and respond accordingly. If you're worried about working in a work environment, well-fitting KN95, I don't think we should be recommending N95s to untrained workers, but I think there are options out there if you want to protect yourself.
Maybe the health department can assist businesses by helping to provide masks. I'm even thinking about what we just heard about the MEMA masks that may be available so that their employees who are concerned and want to protect themselves can, they might be more likely to have a KN95 available.
Great, I can work with Michael on that issue. I do know that, Hannah and her team of nurses is working quite hard on vaccinations, but Santa and I spoke about it, so I can speak for her. We're willing to work with businesses if we could coordinate through Amy Halson, the town economic development manager. If there are businesses that need to get staff vaccinated, we could hold a business specific clinic. We could try to figure out what would be the most convenient time to reach them. There certainly are some things we can do to try to help. We've made that offer before, but we can make it directly again.
Yeah, I think that makes sense. And to provide business specific clinics for vaccinations. Um, I think that's a good idea.
Also, just correct me if I'm wrong, but these businesses, they're private entities. They can have their own mask. They can say, no service if no mask.
Correct.
And if
Yeah,
the
already
Chamber
do.
of Commerce, has enough respondents who are willing to do that, it de facto becomes a blanket mask mandate for businesses.
Yes.
But they can coordinate that. I don't know that we need to mandate that necessarily for the town, particularly on the downswing, but they have the capability of doing exactly what they're asking on their own.
Yeah, many stores in town have signs that say mask required. And the McDonald's has a sign saying masks are required per Board of Health. My husband sent me a
Well,
picture
that's
this week.
Which Board of Health is that?
Yes, I don't know.
That's a good way to
Maybe
have your
it's
cake and
literally
eat it
important.
too.
Boston.
You want a mask mandate, you don't want to get blamed for it, just say someone else said it.
Yeah,
I'm not even mad. That's very creative.
yeah, it is.
I mean, the other thing too is I think we're probably coming into a period where we're going to start changing our thinking a little bit on COVID-19 and start thinking of it more as an endemic situation. So maybe it almost looks like we're trying to play catch up if we institute a mask mandate at this point in time. We could recommend that people do it, but
which we have.
we've done. We've done it. So I think maybe that's as far as we should go.
And specifically after the board's last meeting, one of the emphasis was on high quality masks. So getting away from cloth masks and strongly recommending surgical masks or KN95s if you have them available.
Did you see the kind of infographic that Wellesley put out with regard to their mask recommendation? It was actually quite good.
I didn't see it.
I can't remember if Greg sent that out or someone from the chamber. Someone just sent that out yesterday and I saw it. I can pass that on, but I think that type of visual too was really saying, don't go with cloth masks, really upgrade your mask. And they actually said, wear a surgical mask, maybe because maybe that's all they're providing, or I don't know. But I think something like that, really clear and simple, that maybe even folks could put on, that businesses could put on their front door, might be helpful.
He also sent out results of a survey talking about requiring that people show proof of vaccination to enter a business, which he didn't address in this letter. Which again is, something that if private businesses want to require, they can. He hasn't asked us to mandate that, but it's been done in other places, as you all know.
I think if a business is going to require that, they better make sure all their employees are vaccinated.
Yeah, and I think that should be a big part of our feedback to Greg is, we recommend vaccination for employees that are at risk.
The other point here with the mask,
clinics to help achieve that.
another point with the mask mandate is, who's going to enforce it? Are we going to send the cop out when somebody doesn't put a mask on and fine them? That's not realistic. Our staff can't do it. So you almost make a joke out of it.
And it's about your risk. Like if they're unvaccinated and they're choosing to not wear a mask, that's their risk. I mean, they're choosing that. Vaccinated are spreading it just as much as unvaccinated. I think we've learned that, right? So a vaccine mandate and even a mask mandate isn't going to help with that.
Right. And the other thing that we know is that, most transmission occurs in the home.
Right.
It's not in the supermarket.
Yeah.
Okay. All right. So I think we have some things to feed back to the chamber and some actions we're going to take.
So would we write a letter back to the chamber that we would sign, or have it come from Tim, or they sent us a letter, so.
Certainly up to the board, we could do either. certainly the outreach to businesses, we will have Amy Halson on the agenda a little bit later. We can certainly work with her and quickly reach out to businesses, but if you want a response in writing, we can generate that.
I think we could respond informally.
Okay.
As a request. I mean, there are a number of actions that we can take, but you know, I'd hate to have a letter saying basically, you know, hey, you guys can do this on your own. That just doesn't. I mean, it's true and doesn't sound good. And you know, if they really want that in writing, we can do that, but it might make them look bad, and I'd prefer not to do that.
But yeah, but definitely focus on, focus on the things that they can do.
That they can do and that we can do to help them as well. You know, I mean,
Yep.
Provide technical expertise and what have you.
And such as a vaccine clinic for their staff.
Yep.
Okay. All right. So we'll give them an informal response, Tim.
Yes, sounds good. Mr. Chair, we're running about 20 minutes behind. So maybe I can just ask the staff members who are coming up to try to be a little bit briefer maybe than originally planned.
Yes, indeed. And I think the next thing up is the Sierra Naturals request.
Yes. I think we have Lynn and we have Tara and Diana, who have all served on our marijuana working group. Lynn or Tara, do you want to start? I
don't know if Lynn's still online or. Okay, so Lynn put together. Oh, you're here. Okay. Is she here?
I am. I got disconnected. I was promoted. Are you going to lead it?
Why don't you start, Lynn?
Okay.
You start. And then
so I assume you have before you the memo from Tara and Tiffany about the marijuana questions that came up from Sierra. The memo is divided into 3 parts. There is the summary of the Needham Board of Health Article 20. There is a section on the requests that Sierra made to the board, along with responses and recommendations, and then there are other issues. I will go quickly through the Sierra requests and responses. So their first request was to allow coupons and discounts, and actually the board has numerous times made a strong argument that there is no comparability to the between the marijuana discounts and pharmacy discounts, because the pharmacy discounts non-prescription items. There are no discounts for prescription items other than special senior plans. And Sierra already provides discounts to low-income folks. Sierra made a couple of different arguments about going for the coupons and discounts, but the public health staff in our committee is making the recommendation that the board keeps the 20.6.5 as it is. Their next request was to allow the use of their logo on promotional items and materials. The Needham regulation says that they may not use the logo. The state regulation allows the use of the logo on promotional items. So, oh, wait, I lost that. Sorry, I'm getting a little lost here. Okay. So the public health staff is making the recommendation that the board allows the use of the logo on promotional items, that there's no clear need to, there's no clear benefit to not allowing it. Their third request was that the Board of Health stop requiring a review of their edible packaging. And this was pretty remarkable, actually, in doing the research for this, that the CIRA's argument is that the Cannabis Control Commission already reviews and approves the labeling. But if you take a look at some of the images that have apparently passed through the Cannabis Control Commission, it's pretty remarkable that some of them would not meet our standards. They don't, they're not labeled as having marijuana, they're not labeled as medical marijuana, and some of the packaging is clearly would be attractive to children. If you look at the Wicked Chill in particular. And there are other items in the Somerville site that are far beyond what we would approve in Needham. There are images in the memo that can show that. So the public health staff is recommending that we continue the practice of pre-approving all packaging for edibles. And their final, I think it was their final request, yes, was that we stop requiring that they submit CORI reports to Needham because they are already submitting them to the Cannabis Control Commission. And it was, I think at the last meeting that that Tim had mentioned that there may be some redundancy now that the Cannabis Control Commission is up and running and and their requirements are clear. When we established our regulation, there was nothing comparable on the state level, or nothing as firm as what we had in Needham. So the staff recommendation is that we no longer require the CORI and SORI since they're being submitted to the state. The third section identifies a couple of other issues that were not clearly stated in the CIRA request. One is about posting prices. The Needham regulation does not permit prices to be posted and only allows a list of prices upon request from the customer. The benefit to that is not apparent, and the public health staff recommends posting prices. It's just smarter for the consumer. And the last item, which is the most controversial, is about the packaging of non-edible products. The Needham regulation does not address the packaging for non-edible. It actually doesn't address the pack. It doesn't say that we would review the packaging for edibles either. But there are some concerns, serious, major concerns about some of the packaging that CIRA is using for their non-edibles. The examples that you have before you are trail sticks, which are pre-rolled and have, it looks like a trail mix package. And the description that's on it is, compares it with the Do-si-do cookie and inspired by the mint chocolate chip ice cream. That is, and it doesn't say medical marijuana anywhere. The other example is that body balm, which also does, as far as I could see, it did not mention that it was marijuana at all. And, anybody could just pick that up, balm, thinking that it would be really good for their skin and not know that there's marijuana in it. And so the staff is recommending that the board consider reviewing their non-edible packaging as well. Sorry, you want to add to that?
I think you covered everything pretty much on point, so let's see if the board has any follow-up questions or.
So I think, at least from my own perspective, you've captured the sort of general thinking of the board on all of these things. And I guess I'll just go, we can just address them individually. Do anybody have any concerns about number 1, allowing the discounts, and we're going to keep that as it is without change?
Right.
Everybody okay with
It's
that?
medical marijuana.
Yep. Number 2, to amend 20.6.10 to allow the use of logos. That would bring us in compliance with the Cannabis Control Commission.
Mhm.
Is everybody okay with that?
I'm okay with that.
I don't want to move on until everybody, Christina, you okay with that?
You know, you can go ahead. Sorry, I just had a computer issue. Let me pull that up again.
Okay, number 3 is they asked to change the policy of requiring approval of edible packaging before allowing sales. And, you know, given the examples that I see there, I definitely agree that we should keep that as is.
I agree.
And number 4, the Corey, since it is required by Cannabis Control Commission, and we have the right to request it if we want it, I think that that's reasonable to change that.
I agree.
And then the other 2 issues, posting prices. I don't really have a problem with that. I don't think I would really consider that advertising. I think it's fair for people to know how much they're paying for the product that they're going to take medically or not.
I don't have a problem with them posting prices inside the establishment, but they shouldn't be able to post them whether they're visible from the outside or from the road. In other words, put them a big sign on their front door or something like that.
What about online, Ed?
That's a good one.
I don't know if
I guess that would be all right. So many people shop online these days.
Yeah.
Not for Crest Store, but but still, I do think, yeah, like people want, I don't know, it's just information.
Your concern, Ed, would be that there'd be a big, like, colorful, like, you know, something product, $9.99. That's
Exactly.
Okay.
A big flashing sign saying $9.99
Can we go back to number 2?
trail sticks or something like that.
The logo issue on number 2.
Sure.
I just have a question regarding the regulation from the Cannabis Control Commission. Does that apply to recreational marijuana or medical marijuana, that regulation?
Medical marijuana.
Okay, because it does not actually specify that here. I mean, I suppose we're going to have to allow it. I'm a little bit concerned about that, frankly, because we're talking about promotional items, which is by its very nature advertising.
I mean, I guess we could, one of the things that, we'll get packaging we get to review, I would say that the logo shouldn't be a gargantuan logo on the product. It would need to be a very small thing.
Well,
like
there's nothing that specifies that now, is there?
Can't have a link.
And it says other materials, and I grew up in high school at the time when people walked around with sweatshirts with a big marijuana
Joke,
leaf
yeah.
on it. So that's kind of the first thing that comes to my mind is like, kids in high school walking around with like a Sarah sweatshirt or something like that, because it's not just for labeling or signage. It also says other materials.
I guess like drug companies have notepads with their drug on it and stuff, right? Don't they give out promotional material? You're the doctors, so you get handed stuff like that.
They used to.
Yes, doctors smoke camels.
Yeah. So I don't know. I mean, it's a hard one. It does sound, it said somewhere that it can't have like a leaf on it, right? Right.
Right.
And if that's their logo that's on their letterhead, I don't know. It is interesting. Yeah. There will be a whole market. Can I ask, oh, sorry. I have a question on the topical stuff when we get there.
Okay. So before we get there, why don't we just finish up with number 2? Should we make a recommendation on the size of the logo? It can't be greater than 50% of the size of the package, which would apply to all logos, and then you wouldn't really even want to put it on a shirt.
I don't know, like making something up on the fly, right? I mean,
We could certainly do some more research.
Yeah, I'm looking at the whole one here. So, part 4, permitted practices. I mean, we do have what you've got there. But I think, images that are appealing to persons under 21 years old. So that's gonna be something that we can kind of hang our hat on to some degree. I wouldn't want to see that, a kid wearing a sweatshirt. And that's going to be kind of hard. Then it goes on to, like, I'm just looking at some of this advertising stuff. Brand name sponsorship, advertising in an event. If you're expecting a 21-year-old to be there, you can't do that. I think that we need to get into a little bit more detail about that one.
All right, so should we bring that one back?
Yes.
Okay, so number 2, we'll revisit. With perhaps some more, either not accepted or more restrictions than we have recommended right now. Okay. Sorry, maybe I was moving too quickly. 3 we're okay with? Leaving it the same? No change?
The 3 was.
So we get to approve packaging.
We have to approve
Yeah.
packaging. Yeah.
Okay. And number 4, Corey, that we don't have to see it, but we reserve the right to look at it if we want.
I think that's good.
Yeah.
I agree.
Okay. So the other ones, so pricing.
So I think the consensus might have been that pricing was okay, although large window displays of pricing was not something that the board was interested in.
I mean,
Right,
pricing within the dispensary, I don't have a problem with.
And online, I think is the other.
Online, I think, is the real question, isn't it?
I don't see why it's a concern. I guess, it's providing people with information. I think the idea of, come on down, $9.99 today only, is less about providing information and more about inducing behavior, but.
Right, and I think the former is fine. I mean, presumably their website is going to, restrict, or theoretically restrict to people under, over 21, the same way and as effectively as any, alcoholic beverage website does that, which is to say not at all.
Yep.
Okay.
But I mean, I agree with you. I think it's going to be in the eye of the beholder to some degree. We're going to have to monitor, if they want to just post a price list, but not advertise a price. And I understand that could be a subtle distinction.
Hmm.
But if you have
a price without a promotion. Like,
correct. So
Say
just
all.
here's the name of the product and here's the price. Name of the product and here's the price.
Yeah, like a typed list.
Yes.
Okay. All right. Does that sound reasonable to everyone?
I think so.
Yes, it does.
Just not sure how we put that into, into a reg.
Well, so what we would have to do is based on what the board is indicated it's interested in, the staff will have to take some time. And I would say, I'm not sure we can do it by the 10th of February, but the staff will take some time to redline the existing regulation and to bring it back for the board's actual consideration and vote.
Okay.
To make sure we captured what you said and also just to have a formal vote on the actual change.
Okay. I think that's good. And you give us a chance to see it in context.
Yeah, if we can even get that before we get the packet for the next meeting, that would be great with whatever research you find.
Yeah, I don't think we can commit to getting this
Oh, okay.
on the February agenda. I think it would probably have to be either if we had a second meeting in February or the meeting in March.
Okay.
Okay. And the last item is packaging of non-edibles. Again, it looks like from the examples that we were given that I would think we would want to be able to review those as we do for non-edibles.
I definitely concur on that.
Yes.
Some of that packaging is outrageous.
Why is
the trail sticks? Is it incense? What is it?
They're
why isn't
pre-rolls.
it edible? It looks like it's something you would eat. I don't.
It's a pre-roll.
It's not, it's a pre-roll, it's a joint. It's a pre-rolled cigarette.
Oh,
Yeah.
okay. Sorry, missed that. And then another
Yeah.
question is, maybe for the doctors, do you get high from dermal contact with this stuff? So is it skin lotion that's got a bunch of THC in it? Or are you getting high from that?
Well,
No, that's fine.
I don't know. I would actually have to look to find out, but presumably if you're putting on just maybe on mucous membranes, like on the lips, or
Okay,
you might get some absorption.
okay.
And no personal experience. Steve, do you have any?
I don't, but I think it's a valid question. I'm kind of looking that up myself.
Oh,
and-
okay, all right. So I wasn't crazy. Okay, so
No,
I mean,
no,
it is
you're not
interesting.
crazy at all. I mean, I think they're saying that, what little I'm seeing online here is that, you will wind up with a positive test, but there's probably very little that actually winds up active in the bloodstream.
So it's more of a CBD type it's really, that's where the claims are, right? That, like, does that product even, well, I don't know. I guess it has THC.
Does it do what it says it's doing in reality? Yeah, that I don't know. I think we need to, get some real information about that instead of, the anecdotal stuff that I can find very quickly online.
Right. I was going to say, anecdotally, people just claim that they feel pain relief when they use those type of lotions.
Yeah,
Right.
but
Okay.
that's just placebo effect.
Yeah.
Well,
Could be.
and that can be effective, if it works for people, it's their choice. If there's, but this one it's not just the CBD, it's got THC in it too, I assume. So we want to regulate things that have THC. We're not regulating CBD, like there's a CBD store, we're not regulating.
Right. We don't regulate that. No.
Right.
Right.
Okay.
And
So
this
that
is
would be a distinction.
This is just to review the packaging.
Yeah,
We're not saying whether it works one way or the other.
right. Okay. But I mean, if they were selling something that there is just CBD that doesn't have THC in it, are we involved? Do you know what I mean? Like, do we care if, sorry, is this a distinction that people see? I don't want to drag this on, but we could talk about it. But I think that to me would be more medicinal. Otherwise, like the lotion, for example, doesn't matter. The other ones where you're actually, I guess, smoking it, that's different.
I don't think we regulate CBD. Do we, Jim? Huh.
Right.
So, I
So what
mean,
I'm saying is,
If
can
that's
they
all
just
it had
sell-
in it.
Yeah.
Yeah.
Then we-
it
okay.
wouldn't- Yeah.
So I'm saying in the regulation, if we're going to review packaging on something, it should only be products with THC in it above a certain percentage. Do we know? I don't know.
But it also, the packaging needs to say by our requirements, medical marijuana right on it.
But can they just sell it? I guess the question is, can the CBD store down the street just sell whatever they want? I don't want to hold people to a different standard. Do you know what I mean? Like
The CBD store by the state can't sell any edible products. They can only sell those tinctures and topical.
but this one's a body balm, like that I'm looking at, right?
Right, that's allowed by the state. They're allowed to sell that at the CBD store.
Right. And so why would we regulate it as medical marijuana?
I
down
think,
the
I
street?
think, I'm pretty sure this has THC in it.
Okay, so I mean, that would be the distinction,
The
I think.
Right. Yeah. The Nordic Goddess is medical marijuana.
Okay,
It's not CBD.
okay. So it has,
It needs to say it. And if they want to
Okay.
sell it, we would
Okay.
like to look at their package, I think.
Yeah, I agree. Definitely look at their package.
I know we're behind. I don't want to delay it, but I just wanted to also suggest that maybe, some of these differences in packaging from Needham to Somerville, I mean, that wicked chill, this clarity, the fact that none of this actually says, what, that it's marijuana of any sort, is concerning. And I wonder if we might at some point want to bring this up to the Cannabis Control Commission. I was just looking at their operating principles, and they look like they are open to feedback from folks interested in health. So I think it might be worth thinking about, that our community is very protected in the way that we are regulating these products, but the rest of the state is not. And I think I would be, I can do it as a private citizen, but I also would want us to consider maybe reaching out to the Cannabis Control Commission about that.
I think that's reasonable. I mean, that wicked chill looks like it's, marketed directly to kids.
It's so reminiscent
That
of
makes used to do.
tobacco marketing.
yeah.
Okay. So we have about 15 minutes to get through the last bunch of items.
So I suggest that we skip over Hungry Coyote just because we've covered that so much and get to the other two topics. I'm not sure what order we should take those in the last 15.
We have a decision on Hungry Coyote about the fine.
We already made that decision, I believe, at the last meeting. We were going to fine them for every day that they were open up until they closed. So
There
we
was
voted
this
on that.
question because the town council did not want to pursue the fines because they were criminal fines. So what I was going to present is that on our permit prices, on our fee list, it does say for every inspection that is conducted, which I wanted to define like what type, like us going in to verify that they were open, if that counted as an inspection, then it would be double the fee of their permit. But the other thing I wanted to bring up was that their permit was already issued, so I'm not sure what leverage is left at this point.
Okay. I just didn't want to leave that hanging. If there's no fine that we'd be charging them, then okay. They have appeared to have cooperated after our last meeting with them.
Although they did stay open for 3 more days.
That's true, yeah.
They blatantly violated the order until it was very clear that we were going to go forward with an injunction. And at that point, they said, okay, we'll back off. So, if we do not have some sort of penalty there, what is going to prevent the next business from doing exactly the same thing?
I do think that's a very important point. It also is, at least in my opinion, it wasn't sort of an issue that was gray. I think it was pretty clearly black and white that there were 400 pages worth of inspection reports and violations and photos of a dog in the kitchen and photos of chicken with a thermometer in it saying it was 64 degrees. It wasn't sort of a judgment call. It wasn't personalities. It was they clearly did not have a safe operation serving food. So I don't know that it is something we can figure out in the next 12 minutes, especially when we do have a couple other fairly pressing topics, as well as I just wonder if we need to bring it up at the next meeting again and continue it, because I do think there has to be some repercussion for refusing to comply with a legitimate order.
It would
I
be a
want to chime in and just remind everyone that we only issued a 6-month permit. So if we wanted to go forward with those fines that are on our own fine list and not the criminal fines that Chris Heap was referring to, that we'd probably have to battle out in court, we could tack those on to his upcoming, once his 6-month permit expires, we put those on his application online and say, well, you have to pay off these fines that were issued prior to us giving you the rest of the year. So
Yeah.
we do have that leverage.
Yeah, his
What kind of
permit
a pe-
expires on July 31st. He started this actually yesterday. The consultant started coming in, which was part of the agreement. Is if he shut down, we'd hire a consultant so that he has time to improve. So I did a 6-month permit so that the consultant should be winding down in 4 to 6 months. So towards the end, there should be some time that he doesn't have the consultant. We will reevaluate to make sure that he's actually following, you know, what he was supposed to learn in proper food safety practices, and we can reassess if we're going to issue the permit for the rest of the year. So from August 1st till December 31st.
I mean, one thing we could do is we could issue and stand by the fine, and then if we don't have any problems for the next 6 months and he gets his permit reissued in the end of July, we could waive them at that time.
You know, I
How
like
much
that
is the
idea better.
fine?
I feel like it seems, you know, if all is going well for 6 months, you know, it seems it wouldn't be a good way to further build that relationship with then after a good 6 months to tack a fine on there. So maybe we,
I say we issue the fine now, and as Rob says, not collect it or whatever. And then maybe just, you know, not, you know, just make it null and void at the end if he's cooperating.
Because a fine with double fee, it's $450, and it would be for like ×9, I think.
So that's a significant amount of money. It's almost $5,000. Yeah, and then we could waive it if he's cooperating.
We can discuss more at the next meetings if we're gonna go that way.
Okay.
yeah,
I'm
maybe,
surprised that we didn't make him pay that before you issued him a permit. Frankly, the temporary permit. I mean, again, you know, if there's no repercussion whatsoever, then we've got ourselves a problem.
They
Yeah.
did get their liquor license suspended, right? For
The
30
select
days.
board. Yeah, I think one of the challenges maybe, and we could go into it in more detail. Our review of the tape, especially with town council, seemed to indicate that the board was giving him until Wednesday, basically a week, to get his act together and get his permit in place. So it was our understanding that that was sort of one of the criteria we were operating under.
That was for the injunction. I mean, again, we'd have to listen to the tape, but I thought the fine stayed for every day that he remained open.
That was
And
clear,
we would
yes.
not pursue. We would delay pursuing an injunction until that Wednesday.
Okay. Yep.
That's how I understand that too.
Okay.
I mean, we could look at the tape again, but
That's fine.
And Chris Heath gave us that fine guidance on that, so that's why we could reach back about that. But he said it would have to be fought out in court, which would delay the whole thing.
I'm not interested in a criminal fine. We have fines.
Right.
Those are the ones that we should be imposing.
yeah, those are non-criminal, right?
Yeah, they're civil.
Right, but we needed clarification on what is considered an inspection. I guess that was one of the things Diana had questioned as well. We were like, well, we verified that they were open, but is that the same thing as including the double permit fine? So
It does seem like there's a lot of loose ends here. It might make sense. We we have at least one agenda item that has a guest, Amy Halson. I know that there are, and this isn't a meeting that's open for public comment, but there are a number of attendees who signed on, I believe, and were interested in the 1688 Central Avenue topic. We did get some emails yesterday afternoon and evening and last night about that. So I wonder, Mr. Chair, if we want to keep going on this, or can we pause and move to one of the other items to, I think we could probably postpone synthetic turf to a future meeting.
Agreed. And I think, yeah, we can, this is going to take a little bit more discussion with the Hungry Coyote. So why don't we'll bring
All
that
right,
back.
I'll move we table this discussion until our next meeting.
Okay. I think that's reasonable. Do we need to vote on that or just move it?
No objection.
Okay. All right. So I think the two things we should try and get through the 1688 Central and the brewery concept, because we have a guest here for that.
Yeah.
Yep. If it's okay with the chair, I'll promote Amy Halson and we'll take that item first, if that's okay.
That's fine.
Brewery concept.
Good morning.
Good morning.
Good morning, Amy.
Thank you for allowing me the opportunity to speak with you this morning about the potential of bringing a brewery to Needham. So just to give you a little bit of background, in the fall of 2020, I was contacted by an individual who was interested in opening a brewery in Needham. And as it turns out, our zoning does not allow for the several uses that would take place under one roof for a brewery. So over the last several months, I've done extensive research on breweries to get a better understanding of what it takes to open one and operate one. And just to review that with you very briefly is in order to actually even have a brewery in Massachusetts, you first need to seek federal approval through the Alcohol, Tobacco Tax and Trade Bureau to manufacture alcohol. After the federal permit is obtained, the business must then apply to the state for a brewer's license through the Massachusetts Alcohol Beverages Control Commission. And then on the ABCC's license application, the business must indicate the physical address where the brewery will be located. So a site needs to be selected before they can even apply for a state license. So after the business has obtained a license from the federal and state governments, they can then pursue a pouring license from the town of Needham. So it would be prudent for the town to amend its zoning bylaws now, as a prospective brewery can't seek federal and state licensing to operate a brewery until a site has been selected. So these licensing authorities require proof that the zoning at the site allows for such use. So in short, opening a brewery requires a great deal of time and resources. So the type of business owner that would presumably seek to open one in Needham would be one that has already been thoroughly vetted and screened at both the federal and state levels before they contact us. So as we move forward in discussing what might need to be done to the town zoning bylaws to allow for such use, I wanted to take this opportunity to come in front of all of you and ask for your feedback and guidance and comments and any concerns you might have as far as opening a brewery in the town of Needham.
So only because I've got a hard stop, as I think Tim does as well. My concern is that so far the select board, in my opinion, has not done a very good job enforcing the regulations that we have currently. We actually have the alcohol compliance most recent checks in our packets this month. There were, I believe, 11 license holders out of the 31 who served to minors. There was then a tips training, and there were a number of those license holders who had failed the compliance check who also failed to go to the training. And we have not seen any meaningful use on this. We have a much stricter policy when it comes to tobacco in the town. As a result, we actually have nearly 100% compliance all the time. So before I would feel comfortable, with having a brewery in Needham, I would want to make sure that the alcohol compliance is far better than it is now.
I think that's a very good point, Steve. One of the issues, I think and I know one of our attendees is Miles Tucker, who's the support services manager for the town. I do know that I think town manager and select board are going to be meeting with the violators because they were quite frustrated with the number of people who sold underage. Our staff has had a couple good meetings with Miles, who's now in charge of sort of the licensing component for the select board, about clarifying some of the processes, making sure that there's verification on training, and so we're hopeful going forward. I do think that the brewery concept, I guess, is not as much a worry to me. I'm hoping that maybe in discussing this at more length, we can formalize with the select board hard requirements for an in-person training. Right now it's a training, an approved training that could be online versus in person. There's a lot of data that shows in-person trainings are more effective. The people who go to the training retain more of the information. I'd love to see sort of efforts to make prevention in terms of underage service, in terms of over-pouring, over-service. I think maybe this is an opportunity to work with the select board to tighten up some of those things. But one of the things they did want to ask is have Amy sort of engage the board early. I think the Board of Health has told the select board and the town manager in the past that they've been frustrated when the Board of Health has been engaged sort of as an afterthought on alcohol. So this is Kate and the select board, I think, listening to what the board said and coming early to the table with, an idea that was brought to them.
Tim, I agree with you. I don't see a problem with a brewery from a public health perspective. And towns, there's breweries popping up everywhere. And the process seems to be such that you're only going to get a high quality operation coming in, given all the regulations and things that have to be done up front. But I do think that we should seriously consider using this as a way of working with the selectmen to improve our control, if you want, over the operations of alcohol establishments.
Yeah, I agree, Ed. I think it's definitely time for that conversation to kind of be brought up to the forefront. It's interesting that we, employ staff who work on substance abuse prevention work, but we have no control over things like, alcohol licenses or, those types of things. So when you have, 11 establishments serving to minors, I mean, I think that's a really big problem in a town where when you look at, I don't have the data on me today, but if you look at our stats from 3 years ago, we've got major issues with binge drinking at the high school. You watch from 9th grade to 12th grade, it's a very steep incline in terms of alcohol misuse. And I'm sure Carol could tell us a lot more about that. But that to me has just, continued to be a concern, over these past few years. And so, we're supportive, of course, of new business coming in, but I think we really have to catch up and catch town leaders up on our challenges in this town with alcohol misuse amongst our youth.
I also would say, I assume this will have tastings, and I'm worried about impaired driving. So people kind of, anybody that's done a brewery tour, they bring you to a room and people drink beer very fast and then they, get passed on. So I don't know what this will entail, but like more of a brew pub with food, and I don't want people being rushed through and provided free alcohol and then sent off in their cars to drive away. So that's one concern. too. So we just need to be very careful about how that's done.
Yeah, agreed. That's an important point. Okay. All right, other
We can
discussion?
certainly follow up with Amy and continue to have discussions. And I can certainly, either ask maybe Miles to come to a future board meeting or update the board on the proposed discipline for people who violated with alcohol sales. I know that the select board had drafted what I thought was a pretty favorable response to people who violated the rules, especially repeat violators.
Yeah, that's gotta hurt if they repeat.
I think
All
it
right.
would be great to kind of, to meet Miles and kind of, begin building that relationship too, especially if he's going to be, looking over this licensing and that work.
But thanks for coming to us early and getting our feedback, Amy. It's nice to meet you.
Great. Thanks very much for the
Okay.
opportunity.
Thank you.
Thank you.
Thank you.
I know Steve had to go, Mr. Chair. I have just a minute or two more, and then I might actually make a staff member the host. I think Diana or Tara, I might make them the host. I wanted to briefly introduce the next topic, and the board can continue for whatever length of time it needs to fully discuss it. The 1688 Central Avenue. The board is familiar with its discussions that had occurred over the course of the fall. The board had, and I'm going to be honest, I forget if this was at the November or December meeting, suggested that it wanted to retain its own outside expert to review and verify the proposed plan from the proposed development plan, any sort of remediation efforts, that sort of thing. I was not 100% clear on where the board was sort of falling in terms of, is the board looking for an expert to solely review paperwork that has been presented, or is the board looking for something more? I did work with town council in developing the scope, and I think the one thing I want to mention to people is that town council is concerned. There's no Board of Health authority that would allow the board to have its expert go onto a piece of property, take soil samples, take water samples without the property owner's permission. I have a very expansive view of public health powers, but absent confirmation of environmental contamination, it can't be suggestions, it can't be thoughts of contamination. Absent that, there's nothing that would empower the Board of Health to require access to the property, to require soil samples. So what was proposed here is a limited scope where the town, using its own funds, would retain its own expert to review the documentation submitted to the Board of Health, to review the documentation submitted to the Planning Board, to review the development plan and review the remediation efforts proposed. I think, if to oversimplify greatly, the idea would be to get a sort of, yes, this is a great plan. Yes, this is an acceptable approach, although it might not be the way I would go, or no, this is not acceptable. Someone's trying to pull a fast one on you. This is not at all sufficient. So, sort of to oversimplify, those are sort of the three buckets that I would think that the board would get back if it proposed this scope and hired a professional. They would tell us, yeah, this is great, not my choice, but people will disagree, and I think this is a reasonable approach that someone could take, versus no, I don't think this is acceptable at all. I do know, and as I mentioned, we got a number of emails and some calls I still haven't had a chance to return last night. And I know that in the attendee list, there's some residents that are neighbors of, or in the neighborhood of 1688 Central Ave, who have concerns about the scope. I can forward those emails along to the board's attention later, just later this morning, for you to review. But I wanted to sort of set the table before I made Tara or Diana the host. That sort of, I believe, is what the board needs to discuss. Is this scope sufficient? If it's not sufficient, what changes would the board like? Bearing in mind that it is very challenging for us to put in writing that we're going to pay someone to do something that the board doesn't have the legal authority to have them do. We'll get into a challenging position if we are saying we're going to pay someone X amount of money to do an on-site assessment if we have no authority to require on-site access.
I think I would definitely like to see the emails from the community. So I appreciate that. I just want to take us back to the prior meeting, just also to kind of provide some reference. So, I think we all agreed that this property needs to be looked at. And what we voted on was that we recommended to the planning board that an independent evaluation of the property be conducted, and that an evaluation be submitted for the purpose of determining whether or not testing was necessary or whether or not mitigation is proposed. And yeah, I agree that, there are things that we may not be empowered to do, but our recommended course of action for the planning board was that, that we have an independent person look at this and decide whether testing needed to be done or mitigation needed to be done.
And my understanding is that the planning board's response is not official yet, but is going to be, in a nice way, go right ahead, Board of Health. They're not going to bring in an expert. If the Board of Health wants to bring in its own expert, they can, which is why I have moved money around in the budget and drafted the scope that's available here. So I don't think the planning board is going to retain an expert on its dime for this function. It would be happy for the board to take on that role, but it wasn't going to do it itself.
So the expert comes out of the Board of Health budget?
It could come out of the Board of Health budget. As the board knows, about a year and a half ago, I think it's hard to really keep track. We did propose, and Finance Committee very close vote approved, and town meeting approved a warrant article fund that allowed the Board of Health, I believe it was $50,000, I think, don't quote me on that, to retain outside experts in areas where there wasn't a license fee. So when the board is issuing a permit, the board can make an applicant pay for the board to have an outside expert for things like 5G cell sites, for things like the Eversource underground utility project. The board doesn't have any mechanism to compel an applicant to provide an outside expert. So the town set aside money that is available for us to retain an outside expert, and exists across multiple fiscal years.
To review what the other consultants have done, not to go out and take EMF measurements, for instance. Correct?
So
we do both.
So it could do both. I think I want to throw the caution that town council sort of drummed into me yesterday repeatedly, which is you really can't enter into contracts that require someone to do that which you do not have the authority to allow them to do.
Right.
Gets into all kinds of issues of we would owe them payment because they would have tried. We're not supposed to pay for services we don't receive. So we would have to be clear about what the assignment is. But there is a source of funding that's available for the board to retain an outside expert in this type of area where we don't have the authority to require the applicant to give us an outside expert. And obviously there's value in having an unaffiliated expert who's not paid by the developer to do an assessment.
Well, I mean, at this point, if you have an outside expert who reviews what was tested by whoever the property owners choose to do the testing, and that person determines that the testing was inadequate, then we would have a basis to deny them a permit to build until they resolve that issue. We don't have to test. We can just, based on an expert opinion, refuse to allow them to continue.
I believe the planning board could. I'm not sure the Board of Health could.
Or we could direct the planning board.
That could be our recommendation.
Yeah, I think, yeah, I think the town council wanted me to remind the board that in a situation like this, which is likely to go to litigation, hard evidence is required. So if the board is making its decision, it would need an official report showing environmental contamination. It would need a notification of environmental spill. The likelihood based on, photographs would probably not meet a sufficiency standard. So the board has certainly discretion, but if it was going to go to court, board would have to make sure it's sort of has a good underpinning for why it's making particular orders or decisions.
I mean, I think you're hiring an expert to review the plan that was put out by the LSP, right? I mean, that's not sufficient? Is that we can't force them to, we don't want to go do sampling on this site that, well, we don't even have permission to do or authority to do, correct?
We would need the owner's permission to do that. I do worry a little bit about the precedent. That if people are concerned about development, they say the Board of Health should do soil testing. I think, we know from, and I'm going to forget, Diana, the area on near TripAdvisor, the testings that were done, and they found air contamination.
The Kendrick, the TCE
Right.
at the Kendrick.
So no one knew that was there. There were testing done for an unrelated project, and they found sort of contamination. I think there's real challenges when, I don't know, when you sort of just go randomly looking for things. I do know that we have, and I've made Diana host, we do have 2 attendees with their hands up. The board did not say it was going to accept public comment, but it always has the option to. I do know that, I think if I'm looking at the names right, at least one, maybe both of those attendees had submitted emails, which I will forward to the board's attention. And Tara is also aware of those emails. So I do have to run, but the board can continue.
Okay, thank you, Tim.
Okay.
So I guess we're getting over time. I'm happy to look at the emails. If other people on the board who are still on the call have time, we could hear some brief comments from the concerned parties. Ed and Christina, are you okay with that?
I can put
Yes,
some more time
yeah.
in. I do have an
15 minutes too.
Yeah, 50,
I've got
yeah,
about
2
15.
minutes each, yeah. Thanks.
Okay, so we can promote each person for 2 minutes each, if you can do that, Diana.
I'll put a timer really quick.
Hi, is that Holly?
So it's Holly. Yep, Holly's the first one.
Hi, thanks for joining us, Holly.
Holly,
She
you're
needs to
muted and
unmute.
the camera's off. Just submitted to.
I'm
Ed.
sorry, that
There we
was
go.
me. That was just
No
some
worries.
technical difficulties.
So I'm gonna start the 2 minutes now and let you
Sure.
go, Holly. That's starting.
Just in, I obviously don't know what the conversation was with town council, but what I'm kind of hearing is what is the authority of the board to, and actually under the planning board's regulations and state law, the planning board, the Board of Health is acting under the planning board's jurisdiction. And the planning board clearly has authority to require this testing. And in fact, require, and as this was brought in front of the planning board, the planning department actually for paying their requirement of any applicant to pay for experts, and they have done it in many other cases. That part, they said they had no questions about. Who to pick was a different issue for them. So I am concerned to hear this idea that somehow that the information would be limited because of what the board's authority. Even in the state statute for the planning department could have had a joint meeting with the Board of Health and addressed it that way. It truly is that clear. And secondly, I had sent an email just being concerned. It isn't just photographic evidence. I mean, you have testimony from neighbors. So one of my questions had just been, will all of the information that the board has gotten from emails from neighbors and all the compilations be provided to the expert? So the expert would have that as well. It seemed as simple, I thought actually that was a simple request to make sure that was included in what the records are. But to hear the idea that the Board of Health should be discouraged in checking out this property.
The 2 minutes, sorry, 2 minutes is up.
Seems incorrect, but thank you very much.
Okay, thank you, Holly. And Diana, do you have the next person?
Second, so the next person is Maggie Abranzes. Sorry if I didn't pronounce that correctly.
Hi, Maggie. There she
Oh,
is.
Bruzzi.
Okay, so Maggie, I'm going to start the timer now for 2 minutes.
Terrific. Thank you so much. And thank you for hearing from me. I just want to, I echo Holly in being very concerned that town council is suggesting that the Board of Health has limited or no authority here. I think, in conjunction with the planning board, there is authority to require that this property be safe for what they're proposing to build, which is a daycare facility, one of the most sensitive types of applications you can put on a piece of property. I think also another thing that was talked about at the December 14th meeting was that the history that was shown in great detail raises concerns about this property outside of construction and whether there's contamination that is harming Needham based on this property. So I would encourage you to remember that. And my concern is letting the developer direct what the testing and evaluation should be is perhaps not the best way to go. My understanding was that the Board of Health's expert was going to look at the history of this property and what the federal and state regulations are and say what is required, what does an owner need to do in this situation, and particularly an owner who is looking to build a childcare facility, and what needs to be done to make sure that it is safe for children and people to run a childcare facility on this piece of property.
And the 2 minutes is up in 5 seconds.
Thank
so I
you.
don't know.
Thank you.
Okay, thank you. Thank you. So, I think we all agree this property needs to be looked at. I think that we're going to need to have probably a member of the planning board meet with us and with town council to further define exactly what our powers are, whether it's under Board of Health or planning board, before we proceed with hiring an independent contractor. I mean, I just think we need more information. I'm not an attorney, so I would need to review myself, whether the board would have the power to do certain testing or not.
I don't think we probably do have the power to go in there and just test or pay someone to test. But But I think that we have the authority and the power to tell the planning board that they should not issue a permit until that testing is done.
I mean, I think we hire a consultant who reviews the plan. I guess I don't see how we're different. It seems you review what's out there, you look at the site history, all the documentation that's been provided, and then say, okay, based on this is how I would assess the site or go further. I mean, I don't see how I don't see us going out to collect samples. I see us reviewing the plans, the history of the site, and determining what probably needs to be done by the developer.
That's exactly it, Kathleen.
Okay. So anyway, we can talk with whatever the contracting or whatever the authority, we can talk, you should, or if you do a chairs meeting or something, that's fine with the town council. But I think we're kind of on the same page, it seems. I just think, yeah, the question of, who's actually taking the soil samples is not going to be Board of Health subcontractor, I don't think, or Board of Health contractor. But we'll learn more from the town council.
Okay. All right, so let's feed back to Tim that we can either have a chairs meeting with town council, or we can have planning board and town council come to our next meeting.
I think
give
that
those options.
would probably be a good idea
Mhm.
to have them, have all of us at the table
Right,
together.
I think everybody needs to be there,
Mhm.
Yeah.
just so we don't end up batting it back and forth.
Okay.
Okay. All right, we're way over. I think we will, alcohol compliance checks, we're gonna have to move, I think, and tips training to the next meeting is same with the synthetic field turf results, if everybody's okay with that.
Okay.
Okay. And with that, I'll entertain a motion to adjourn.
Okay, I move we adjourn.
Second.
Okay, all in favor?
Aye. Ed,
Aye.
aye.
Kathleen, aye.
Christina, aye.
And Rob, aye. Thank you, everybody, for your time.
Okay, thank you.
Thanks, everyone. Take care.
Thank you.
Okay.
Bye.